Heidi Toplansky was preparing for a replacement surgery, taking care of her children and her dying mother, when...
And all of a sudden, I got this out of the blue routine mammogram breast cancer diagnosis.
She was diagnosed with 2 different cancers back in 2012, one in each breast. For her left, she qualified for a less common targeted treatment known as Intraoperative Radiation Therapy, or IORT.
The way it works is, in my opinion, ingenious and amazing.
Dr. Alice Police is a breast surgical oncologist. She started 3 different IORT programs in the United States over the past 20 years. She's also Heidi's doctor.
It's targeted radiation therapy to the lumpectomy cavity.
In IORT, the dose is delivered while performing a lumpectomy right to the part of the breast where a tumor was removed. It takes 18 to 40 minutes. It's not for everyone. It's generally meant for postmenopausal women with early-stage small cancers, and in some cases may require additional radiation therapy. But the ease of the procedure and the lower cost make it worthwhile for many patients.
It is such a wonderful option.
At roughly $8,000 to $10,000, it costs much less than traditional radiation therapy, which requires multiple sessions.
How did you pay for your IORT treatment?
My insurance paid for it.
But that's not always the case. While Medicare and Medicaid cover the cost of IORT, and it's a more common treatment in other countries, some private insurers in the U.S. and Medicare Advantage plans deny coverage.
We know that the recurrence rate with intraoperative radiation therapy is higher than with other methods of partial breast irradiation or whole breast.
Dr. Catherine Yashar is the president-elect of the American Society for Radiation Oncology, or ASTRO. The organization does not recommend IORT unless part of a clinical trial or registry. But NBC News spoke to roughly a dozen breast cancer surgeons who say the economics of medicine is playing a major role. Medicare reimbursement data shows that for IORT, oncologists receive less than half what they get from traditional radiation. Hospitals also charge facility fees for repeated radiation sessions. Astro says that it's not a fact.
We don't have control over what insurance companies decide to cover or not cover.
We also asked Astro whether they consider things like travel time, gas money, and having to take off work to get traditional treatment.
We absolutely are sensitive to the patient experience and the socioeconomics, and it is definitely more convenient for patients. But again, I think that we have to balance that with the control rate.
For about 80% of people who undergo IORT, that's it, one and done. But for others,
sometimes we find a lymph node that's positive on final pathology, which comes a week after surgery, and the patient will go back and have whole breast radiation.
And that is what happened to Heidi Toplansky. Her full pathology report revealing additional cancerous cells after the lumpectomy, and she needed whole breast radiation.
It's like you're a piece of hamburger on a barbecue grill. So for months after the radiation, I was exhausted. I mean, the fatigue, the tired, the scar tissue.
What would you tell someone who was just diagnosed with breast cancer if they had the potential to get IORT?
Do it. Don't even think twice. Just do it.
Surgeons NBC News spoke with encourage qualifying patients to ask their physicians about IORT. It isn't without consequence. Heidi says scar tissue the size of a golf ball developed in her left breast. But research shows IORT reduces the risk of possible heart and lung problems associated with traditional radiation.
So I just think that we are missing an opportunity if we are not investing heavily in this.
Now, Heidi remains cancer-free thanks to modern medicine. And like many, hopes one day IORT will be a first line of defense in fighting breast cancer.
Yaz is joining us now. Yaz, you alluded to this in the piece, that the treatment it's not like a blanket treatment for anybody who has breast cancer. Who would qualify for it? How do you know if you'd be eligible?
Yeah, Hal, so not everybody qualifies for it. You got to have early stage, low risk of recurrence breast cancer. You have to be getting a lumpectomy versus a mastectomy, which is the removal of the entire breast, over 50 years of age and or post-menopausal, and without any kind of lymph node infections, as we heard from Dr. Alice Police there as well. And I will say, when it comes to the advocacy here for getting IORT covered by more private insurers. There's not a lot of it because of the guidance, for instance, from organizations like ASTRO that are now deeming it experimental. And so what a lot of doctors that we've been speaking with and experts have been telling us is that this is going to come down to patient advocacy, right? Patients going to their doctors asking about this treatment. Do I qualify for this treatment? And then advocating it for it more on a kind of lawmaker, legislative level to get insurers to stand up and pay attention.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.